Working families have been hit so hard in this emergency, and it's also underscored all the inequalities that we have in our society. The work that still needs to be done for racial and economic justice, for those of the community that have underlying health conditions, how hard hit it has been, and of course we know among the most vulnerable population are Angelenos who are experiencing homelessness. Our homeless neighbors know that this was a crisis long before COVID-19 hit. We were already confronting this crisis with record investment, building more shelter beds than any city in the country, over 2,000 of them in an 18-month period. But tonight I'm enacting some orders to help accelerate the work that we are doing, to extend our affordable housing, to make sure that fewer people stay or become homeless. So tonight, all housing department deadlines that are related to financing affordable and supportive housing for people who need affordable housing or people experiencing homelessness will be extended. That will ensure that affordable housing development can continue without any penalties caused by missed deadlines, and that funding won't disappear because of this crisis. We need that housing. We need every single apartment and every single bed that we can build. And with this virus touching every part of our community, we're doing whatever we can to keep those without a home safe. We've described many of those in briefings before, the hundreds of sanitation stations to wash hands and have soap on the street, the porta potties, the testing that we're doing. And I think that we continue to need more screening, testing, and treatment to help Angelenos who are experiencing homelessness. So starting Monday, I'm proud to announce our city will surge a deployment of street medical teams to help fight COVID-19 among Angelenos who are experiencing homelessness. We'll send out field teams to provide rapid results field tests for people showing symptoms, health and welfare screenings in high-density encampments, which have already started and are in, I think, north of 1,000 visits already, and advice and guidance on effective physical distancing on the streets. We'll offer transportation to new shelters and to hotel rooms to bring unhoused folks inside, and we'll send extra resources, additional county nursing staff, and homeless outreach workers to Skid Row. And our fire department will set up a high-capacity pop-up testing clinic in that neighborhood to deliver fast results. It features physically distanced waiting rooms and provides direct referral and transport to isolation and quarantine beds. All of this means that if we encounter somebody who's living on the street or in their car, somebody who's in a shelter who's sick, they'll be able to test them right away and see if their symptoms are related to COVID-19. And if needed, they'll be able to call in EMS transport to immediately bring unhoused folks to safety. We can do this thanks to our skilled workers across the city and the county who I want to thank. Our skillful firefighters and police officers, the brave work of our homeless service providers, outreach staff, nurses, and medical professionals, our partners at the Los Angeles Homeless Services Authority and the Department of Health Services, and our leaders at the Unified Homelessness Response Center, which is run all the time, even before this crisis, out of our Emergency Operations Center, who are coordinating this bold strategy. And our work to serve Angelenos who are experiencing homelessness doesn't end there. We're already ramping up beds and services at our Rec and Parks facilities, now more than 850 beds, and 4 more due to open soon. They're at 95% capacity. And tonight, we're launching our first trailer program, utilizing trailers that were given to us by the state, one of the first cities to get these up and running. They will be used to house homeless Angelenos who are in the highest risk Tier 1 category. That's asymptomatic individuals, so they're not sick yet, who are over 65 years of age, have chronic medical conditions, or both. The first 10 are going to open on the campus of Woodland Hills, and our goal is to provide more than 300 trailers citywide in the coming weeks. As you can see, we're deploying every resource to help people who are most vulnerable and susceptible in this crisis.